in the previous videos, we were discussing about the various physical properties and numerous aspects related to it. So today we'll be discussing about the biological properties of a dental material. So why do you have to learn about this? So this is going to relate or find out the efficacy of the drug or how good patient compliance it has. If a material is not biologically compatible or causes more harm than good to the patient, it fails its purpose, whichever it is intended to do. Now, so in light of this, you have to learn the ideal biological properties. So there are 5. It should be non-toxic, it should be non-irritant, it should not produce any allergic reaction, it should not be mutagenic, and it should not be a carcinogenic material. So, based on the biological perspective, a dental material can be divided into few types, mainly into 6 types. So, the first one is the material which is going to come in contact with the soft tissue of the tooth. You can compare it to a impression material or the denture based materials. Now, which would affect the health of the pulp, mainly your dental cements or your varnish, all those things. This can be kept like this. Or you can talk about the calcium hydroxide, which is used for direct pulp capping technique. Then those which could affect the periapical area, mainly the root canal medicaments, obturant material, all those things which are used in a root canal therapy. Then those which could affect the hard tissues of the tooth, like a restorative materials. Then those which are used in the dental lab for fabricating dental materials like ceramic or your alloys in the cast partial denture. So I told you there are some problems. So what can be these problems? So I'll give you a few examples to just orient you straight to the topic. So when you're using a dental cement, we know that majority of these dental cements have acidic component. Like we are talking about zinc phosphate, means there is phosphoric acid. So these materials can leach in through the odontoblastic process and reach the pulp, causing pulpal irritation. Again, with a polymer based filling material like composite, when you use a smaller filler size material, it can cause pulpal irritation. Then when you're talking about acid etching for composite or for your dentine bonding or for orthodontic bracket bonding, we can use an acid etchant like phosphoric acid. This can also cause pulpal irritation if it is not done properly. Then amalgam, as we all know, it has mercury for its proper mixing. So this will release mercury vapor, which is extremely toxic and needs to be handled with caution. Alginate again is a powder material which is mixed with water to form an impression material. Now this will release dust which can contain lead, which is harmful for the body. Now again, as we know, the denture based materials, they are mixed by using a monomer. This is again an irritant to the soft tissues. Nickel alloy. So some people actually have allergy to nickel. So when these people are exposed to this metal, either in the form of an orthodontic wire or as a component in the denture material for cast partial dentures, they are going to develop a form of severe allergy. So care should be taken before a treatment is done to such allergic people. So what is a biomaterial? So biomaterial is any substance other than a drug that can be used for any period of time as a part of a system which treats, augments or replaces any tissue, organ or function of the body. So it just simply says that any material which you are keeping in the body, be it a dental material or any prosthetic for any part of the body, even a pacemaker, you should make sure that it is compatible to the body's normal physiology. That is, it does not evoke any kind of an irritating, allergic or carcinogenic response in that particular body. If it is not formed, then that material is a biologically compatible material or a biomaterial. So now, there are certain factors which affect the pulpal health, especially when a dental material is used. So what are all these factors? So first we'll see what is a microleakage. So you are keeping a like you have a dental caries, like a class 1 dental caries. So you are doing a cavity preparation and then keeping a restorative material, like this pink color denotes a restorative material that is kept. So visually or macroscopically, when we are seeing, it is fitting properly into the cavity space, but actually majority of the restorative materials lack the ability to adhere to the tooth wall properly. So when we are seeing at a microscopic level, this blue actually indicates the space between the tooth and the restorative material. So there is some microscopic space between the tooth and the restorative material. So after some time, what happens is fluid, microbes and debris will move into this space, thereby facilitating further decrease or further seepage of this material through the space, reaching finally into the pulp even. So now this is called as microleakage. So now this microleakage can finally lead to secondary caries, a stain or discoloration or even sensitivity. So thermal changes, that is extreme hot or cold exposed to these restorative or dental materials, can also have some negative implications. So temperature fluctuations can crack the restoration or produce an undesirable dimensional change. So in the previous videos, we talked about how temperature can affect the strength and other aspects of a dental material. So these properties will come into play here. Now, how does this change happen? So it can be caused by either thermal expansion, that is in response to heat, it is going to either expand, or in response to the cold, it will undergo contraction. Now, majority of the restorative materials are made up of metals, as we know. Now, these metals can conduct heat and cold very rapidly. So, in some individuals, when it is not protected, when the restoration and the tooth are not protected properly, what happens is it can give rise to sensitivity while having a hot or a cold foot. Now, this is more evident in large restoration, wherein the remaining dentinal thickness is going to be very small, especially on the pulpal floor. So, in such conditions, there is no pulpal insulation, and this heat or the cold, that effect will be easily transmitted to the pulp, causing pain or sensitivity. So, how can this be rectified? It can be rectified by using either a base or an insulating cement. That is, you can use either a varnish or a cement to provide a protective layer to prevent the provide like an insulation to the pulp. There is something called as galvanism. So this is produced when two different metallic restorations are either opposing each other or are given in two adjacent teeth. Here, what is going to happen is that these two metals are going to produce a potential difference. That is, one will act as a cathode and the other, or a positively charged electrode, and the other will act as an anode or a negatively charged electrode. So now the saliva in between this is going to act as the electrolyte. Thereby, when these two teeth come in contact, there is a production of an electric current producing a galvanic shock resulting in pain. This is what is called as galvanism. Now, people have different response to this. This is mainly because the current produced can be from 20 to 50 microampere. So, either the patient will develop a minor sensitivity, that is the current produced is very low, or it can be severe pain because the current produced is very high. I talked about the different properties, why you need to talk about the biocompatibility. What are the types of adverse reactions that are produced by these dental materials? For us to talk so much about them, learn so much about them before we start using them or more manufacturing more. So these adverse reactions can be toxic, as in the release of mercury vapor from amalgam. It can be inflammatory, like the papillary hyperplasia that you see, or the epulis fissuratum, those kind of reactions that is produced in response to the monomer by the denture-based resin. Or it can be an allergic response as produced by the nickel in various alloys. Or it can be mutagenic. So few ceramic materials that are used in fabrication of either a restorative material or a crown, it contains uranium. So uranium, as we know, it's a mutagenic material. So this can produce more harm than good to that particular individual. Now, this is the arbitrary classification. So you can again classify it based on its effect into local effect or systemic effect. Now, the local effect is when the material is in direct contact, like an allergy to a prosthesis. Or it can be a systemic effect wherein the material is absorbed by the body. So it can be caused by either a local absorption, ingestion, or inhalation. Now let's talk about the various toxicity tests. So how do you find out if this material is compatible or not? If it is producing any adverse effects or not? It's similar to all the preclinical trial that you do for other drugs. So there are 3 levels of test. So the first level or level 1 tests are actually screening tests. So this is going to check for acute systemic toxicity, cytotoxicity, irritation, allergy, and any carcinogenic properties. So first, acute systemic toxicity is tested by injecting the material A into animals. Now you are going to follow up these animals for a predetermined type. If more than 50% survive, then the material is safe to use. So in cytotoxic screening, there are 2 methods. It can be in vivo method or in vitro method. So now in vivo method, like with the previous condition, the test is going to be conducted in animals. In vitro technique, it will be done on culture cells. So the material will be incubated with the cultured cell, and you look at these live cells at the end of the technique. So one of the most commonly followed procedure is going to be the agar overlay technique, wherein the agar is spread over a layer of the cultured cells in the culture plate, and then it is going to be incubated with that particular dental material. So if it is a safe material, it will be like in picture B, wherein no lysis is seen. It's going to be a clear culture. Whereas if the material is toxic, it will be as in picture A, wherein you can see numerous areas of clear zone of dead cells. So next, we'll talk about how to find out the irritational property. So the material will be placed in skin of rat or in rabbit. So it will be injected intramuscularly or subcutaneously. Then the animal is killed at different time intervals and the tissue response is assessed and then compared with other control like safe materials and unsafe materials. Then talking about the allergic potential. So how this can be found is that the material is placed inside the skin of the guinea pig or a rat, and then later it is transferred to the skin surface. If it is allergic, it will produce erythema and swelling. Finally, the carcinogenic potential again is found out using in vivo test and in vitro test. So in vivo test, the material is placed beneath the skin or in subcutaneously in a mice. It is killed after 1 to 2 years and then examined for the presence of any tumors. Whereas in vitro test, the most commonly conducted test is the EAMS test. It is again very important short note question and an entrance question. So here, the material is tested with the help of mutant histidine dependent bacteria. So what it is, a control material is taken where no mutagen is present, and the material with suspected mutation or the experimental sample is put in a rat liver extract, and then the culture of histidine dependent salmonella is taken and then put in a media lacking histidine. So if the material contains mutational property, it will mutate the bacteria into histidine independent salmonella, thereby allowing it to proliferate or grow more. Whereas in a condition where there is no mutagen, what happens is it lacks the ability to survive without histidine, thereby majority of the bacteria will die off and the culture plate will only show few colonies or no colonies. This is how EAMS test is done. Next, the level 2 tests are usage test, wherein the material is used in experimental animals in the way it is intended to be used in human beings. So if you want to use that material to make a crown, you will make a crown with that thing and you will keep it in the animal. Again, if you want to make a root canal filling or a root canal instrument, you will make it and you will do the therapy in the animal. Next, the final one or the level 3 test are human trials, wherein one screening and usage test is done and the material passes all these tests. The reaction and the performance of how it is going to be in a human is tested in voluntary subjects. So apart from all these harmful properties, physical properties, there are some therapeutic effects that are seen in some of the dental materials. So for example, it is the zinc oxide eugenol. So it has pain relieving effect on an irritated pulp. So it is used as a cement material. Then calcium hydroxide, which is used for pulp capping. It has the ability to produce secondary dentine, thereby helping in repair of dentine, especially when it's used as a direct pulp capping material. So another important property to be seen is osseointegration. So it is essential in case of implant. So when an implant is placed, the most common material used in implant is titanium. So the titanium will form an oxide layer, that is titanium oxide layer on the surface. This facilitates the deposition of bone. Now, this is called as osseointegration. In some cases, this integration can take place by formation of intervening connective tissue or fibrous tissue. In such cases, it will inevitably results in the failure of the implant. And if a bone is actually deposited, it is called as biointegration. So final topic is that of infection control. So there is increased interest because of an increased or expanding risk of infection, possibly because of an increased risk of cross-contamination through various instruments and materials used in dentistry. This is very important, especially when we are facing a pandemic like novel coronavirus infection. Again, previously hepatitis B virus and human immunodeficiency virus were also shown to be transmitted through this path. So the various routes of spread or routes of transmission of the infection is by contaminated instrument or a needle, saliva or blood, through aerosol which is released during usage of air or rotor handpieces, and then finally by the contaminated dental material as with an impression material or a denture. So how can you disinfect the various materials that are used in dentistry? So first of all, you can autoclave or use cold sterilization for few your instruments that are used. Then when you're disinfecting an impression that is taken from the patient, you should make sure that the disinfecting material does not alter the property or accuracy of the said impression. If the impression is not disinfected, the cast that is formed should be disinfected before handling it. So how can this be disinfected? It can either be immersed in the disinfectant can be sprayed on the material, or you can incorporate the disinfectant in the said impression material. Again, restoration or prosthesis can also be disinfected. So the most important point of this disinfection comes in case of a prosthesis. So before the process is fabricated in the final try, there are previous other trial procedures. So there will be your jaw relation, then trying is done after the teeth is set. So after all these procedures, you are going to take this thing and bring it back to the lab, or you will be handling it directly. So if the patient has any infection, it can be easily transmitted. Again, complete dentures are considered as massive reservoirs of contaminant microbials. So again, these microbials can be released in the form of aerosol while it's polished or it's trimmed. So this is like considered as a primary source in the cycle of cross-contamination in dental labs. So they should be disinfected at every step before it is being handled by either the lab technician or it is kept inside the patient's mouth. I really hope that you found this video helpful and informative. So if you have any queries or you felt like any topic is not explained properly, please don't hesitate to send us a comment in the comment box, or you can send us a DM in our Instagram page cracking.den_edu.redefine. Please keep in touch and stay safe.